New York hospitals are giving gastric medications to COVID-19 patients to see if they can help fight the virus, according to the doctor who initiated the trial. Preliminary results from a clinical trial of famotidine, the active ingredient in Pepcid, could come within a few weeks, said Dr. Tracey of Northwell Health's Feinstein Institute, which operates 23 hospitals in New York City. Range. So far, 187 patients have been enrolled in clinical trials, and Northwell wants to eventually enroll in 1,200. Tracey said. There are many examples in the history of medicine where drugs designed for one purpose were found to affect another disease. He said if famotidine works, and if it's easy at this point to use it on a wide range of scales, it's great. It's common, it's plentiful, and it's cheap, but he stressed that it might not work. I don't know if it will bring any benefit. We really don't. I swear I don't, he said. People want something, but we need to do this clinical trial. He also emphasized that the patient under study was given large doses intravenously to the hospital, about 9 times the dose that someone would normally take for heartburn. Don't go to a drugstore and take lots of heartburn medicines, he said. Tracey and his colleagues got the idea of studying famotidine after it was observed that some Chinese patients taking the drug performed better than those who did not. Although no studies have been published on Chinese patients, Dr. Michael Callahan, an infectious disease specialist at the Massachusetts General Hospital who worked on patients with COVID-19 in China, found that those with low incomes live longer than those who are rich. I have noticed that. I also had heartburn. When Callahan and a Chinese doctor approached, many of the low-income people were taking famotidine, while the wealthy patients were more likely to take another, more expensive drug. The poor peasants seem to be doing really well with famotidine, Tracey said. There are many anecdotes that give us hope. No comments were obtained from Callahan. The study of famotidine was first reported in Science magazine. In addition to observing patients in China, Tracey said the Florida-based Alchemra Laboratories will use a computer model to create a list of existing drugs that could fight COVID-19, with famotidine listed. It appeared near the top. Theoretically, famotidine structure is such that it can stop the replication of the virus in the same way that protease inhibitors used to treat HIV stop the virus. In the Northwell study, all patients take hydroxychloroquine. Tracey said doctors and patients insisted on the use of hydroxychloroquine when the study began in early April, effectively making it the standard of care. President Trump frequently advertises the drug as a game changer in the fight against the virus, but recent research suggests the drug is useless. You must be fair to people. They are reading the paper and hearing the news that hydroxychloroquine works. They want to see their dying wife or grandma or child and try it. Someone would say no, said Tracey. Half of the patients in the study will be given famotidine in addition to hydroxychloroquine. The other half are given intravenous saline as an ineffective placebo. From last week's study, hydroxychloroquine may not be used in future studies. The U.S. Food and Drug Administration has warned against using COVID-19 because of potential side effects. Tracey said the independent committee overseeing the trial will make a decision on whether to continue to include hydroxychloroquine in the trial. He added that Northwell had quieted the study so far, as doctors had rushed patients to hydroxychloroquine. He doesn't want the same rush to intravenous famotidine. It's unclear if it works, and if he's rushed to the drug, his research team may not be enough for the study subject. He was also worried that people without heartburn would rush to the store to buy famotidine tablets, and he was confident that it would help the coronavirus. Patients with heartburn may experience a temporary stagnation, especially as the FDA withdrew Zantac, another heartburn treatment, from the market earlier this month due to potential contamination. He said these are extraordinary concerns at extraordinary times. Let me explain about famotidine. What is famotidine? Prescription famotidine oral tablets are available as generic and branded products. The brand name is Pepcid. Generic drugs are usually less expensive than branded versions. In some cases, branded drugs may not be available in all strengths and forms. The formulation famotidine is also available as an oral suspension and injectable form, which is provided only by the healthcare provider. Famotidine is also offered as an over-the-counter (OTC) drug. It is offered as OTC oral tablets and OTC chewable oral tablets. This article focuses on prescription oral tablets. Famotidine is used to relieve the symptoms of acid reflux and heartburn. It does this by reducing the amount of acid in your stomach. Handles the following conditions: gastroesophageal reflux disease, GERD. Gastroesophageal reflux disease occurs when acid in the stomach refluxes into the esophagus, the tube that connects the mouth and stomach. This can cause burning sensations in the chest and throat, sourness in the mouth, or belching. Acid-related damage to the lining of the esophagus. Splashes of gastric acid in the lower part of the esophagus can damage tissue cells in the esophagus. Duodenal ulcer. The duodenal area is the part of the intestine through which food passes when it leaves the stomach. Gastric ulcer. Also called a gastric ulcer, it is a painful ulcer on the stomach mucous membrane. The stomach is making too much acid. These conditions include Zollinger-Ellison syndrome. This drug may be used as part of combination therapy. That is, you may need to take it with other medications. Famotidine belongs to a class of drugs called histamine 2 receptor blockers. Drug classes are groups of drugs that function in a similar way. These drugs are used to treat similar symptoms. Famotidine works by blocking the gastric histamine 2 receptor. This receptor helps release the acid in your stomach. By blocking this receptor, the drug reduces the amount of acid released from the stomach. Famotidine oral tablets can interact with some other drugs. Different interactions have different effects. For example, some may interfere with the effectiveness of the drug, and others may cause increased side effects. Before taking famotidine, be sure to tell your doctor and pharmacist about all prescription, over-the-counter, and other medications you are taking. It also describes the vitamins, herbs, and supplements you are using. Sharing this information will help to avoid potential interactions. Talk to your doctor or pharmacist if you have any questions about drug interactions that may affect you. Famotidine oral tablets are used for long-term treatment of Zollinger-Ellison syndrome and maintenance of ulcer healing. Famotidine oral tablets are used for the short-term treatment of gastroesophageal reflux disease, GERD, and duodenal and gastric ulcers. Famotidine is risky if not taken as prescribed. If you suddenly stop taking the drug or never take it, acid reflux, heartburn, or ulcer symptoms may not improve or worsen. If you miss a dose or don't take your medication as scheduled, your medication may not work or may stop working altogether. For this drug to work well, a certain amount must always be in your body. Overdose, your body may contain dangerous levels of a drug. Symptoms of overdose of this drug include agitation, confusion, seizures, and severe muscle aches. If you think you have taken this medicine too much, please contact your doctor or local poison control center. If you have severe symptoms, call 911 or go to the nearest emergency room immediately.